Good morning, this is Dr. Ceballos. I'm an internal medicine doctor. I work with OakBend. I've been with OakBend for the last 3 years. And I'm here today to talk to you about diabetes. Diabetes is a very common disease, aging related, who has a very high prevalence, almost 5.8 to 12% per year. It's a disease that affected many organs. Like you know, diabetes is high blood sugar. It's a fasting blood sugar more than 126. And that's not really the problem. The problem is the consequences that diabetes can cause to your body. It may affect your kidneys, your heart, your brain, your skin, your nerves, causing problems. And diabetes presents like in a very with a very vague symptoms like thirstiness. People feel very thirsty, or they are urinating more than often, they are weight loss, or feeling tired or fatigue. And the only way to know if it's diabetes or not is checking your blood sugar. We can do it in our clinic. But really the test that is going to tell us for sure if you are diabetic is a test that we call Hemoglobin A1c. That test is going to tell us how high has been your blood sugar running for the last 3 months. And nowadays it's part of the American Diabetes Association diagnosis criteria. If your hemoglobin A1c is more than 6.5, you are diabetic. And it's a blood test that it can be done, and you don't need to be fasting to do it. Now, and we can check your sugar randomly, and if it's more than 200 and you have symptoms of diabetes, that's another criteria to diagnose diabetes mellitus. Like I said earlier, diabetes causes damage in your tiny small arteries and also in your big arteries, and we call it microvascular lesions or macrovascular lesions. And you know that we have arteries everywhere. For that reason, diabetes may potentially affect your organs, any organs in your body. We know that it's a major risk factor for coronary artery disease, for stroke. It's the most common cause of kidney failure, and is the most common cause of people ending up in dialysis. Cause neuropathy. When the tiny vessels or arteries are affected, the nerves are affected, and you may face, or people with diabetes may face pain, neuropathic pain, leg pain. I don't know if you are seeing the commercials in TV, the pharmaceutical companies trying to sell medications for that, and they describe the pain like a burning sensation, you know, on your feet. For that reason, it's very important to check for diabetes. Even if you don't have symptoms, if you are older than 40, if you have family history of diabetes, go to your doctor, ask to be checked, ask to check your hemoglobin A1c. Because the complications, once you are diagnosed diabetes mellitus, you're gonna face, if you don't get treatment, you're gonna face the complications in 5 to 10 years, and that's the thing that we don't want. Cause a lot of problems, mortality, of course, heart attack and strokes, and comorbidities, chronic pain, and many other issues with your eyes. For example, we have arteries in our retina, and if your small arteries are affected, they may potentially cause damage in your retina and causing blurred vision and blindness. That's why it's very important to go to your doctor, ask your doctor to check your blood, tell your doctor about your symptoms, and if you don't have a doctor, and if you have questions, feel free to call my office and I'll be happy to talk to you. Thank you.